So you have just come out of the operation theatre and you have just gotten a new knee replacement done. What happens after this? So you will be usually in the hospital for around 2 to 3 days. In the first 2 days, the physicians and surgeons will focus on your general condition and pain management. You will be out of the bed around this first day of the surgery, that is within 24 hours of the surgery. In the first few days, you will need a walker for support. Gradually, physical therapist will assist you leave your walker and get to the stick. Usually it requires around 5 to 7 days for any person to get rid of the walker and go to a stick. Pain after knee replacement surgery usually takes 5 to 7 days to subside. You can resume your normal activities of living like going for a walk, driving a car in around 15 to 20 days of surgery. Activities of recreation like non-contact sports, cycling, brisk walking, swimming are usually recommended 4 to 6 weeks after surgery. There is no fixed time of recovery after a knee replacement and varies from person to person. It can be as short as 2 to 4 weeks after a knee replacement surgeries to last as long as a year after knee replacement surgeries when you get full results of a knee replacement.